Well, good morning, and thank you for logging in. My name is Adrienne Alpert. I'm from ABC7 here in Los Angeles, where I am a reporter and host of the public affairs program, Eyewitness Newsmakers. I am your moderator for today's webinar. We are all coming to you from home today, following physical distancing under orders of COVID-19. But I'm happy to be able to participate again this year in the second Luskin Summit. The theme is a call to action. And in a few moments, you're going to hear from our featured speakers. But first, here are some ground rules for this webinar. You will have an opportunity to ask questions of the panelists, and this is an important part of the Luskin Summit, using the Q&A function that should be visible at the bottom of your Zoom window. Questions are visible only to the hosts. The Luskin School has an off-camera technical advisor watching the Q&A stream, so please be kind and please be concise with your questions. This event is being recorded, and a version will be available on the internet online on luskin.ucla.edu/summit. This virtual conference is possible because of the generosity of several organizations. The lead sponsor is Bank of America. Joining us today is Danielle Campos, Senior Vice President. She is the director of a Bank of America program that focuses on environmental, social, and governance leadership. Ms. Campos is a graduate of UCLA with a degree in sociology, and she is a past president of the UCLA Latino Alumni Association. Danielle, we'd love to hear from you.
Well, thanks, Adrienne, and good morning. And on behalf of our over 6,000 Bank of America teammates here in LA and my colleagues on the line, we are glad to be here with you today as a supporter of the Luskin Virtual Summit and the series of conversations that will follow. A little different venue from last year. I was able to see Adrienne and most of you in person, but I do want to applaud the Luskin Center, faculty and staff, and Dr. Segura on their ability to pivot and adapt, and thank them for providing the opportunity for us to come together to discuss some of the unanticipated effects of this pandemic, as its multi-layered impacts continue to evolve. As the pandemic unfolded, we also had to pivot our focus and resources, with the number one priority being helping our teammates, clients, and our communities navigate it through a really unprecedented time in our lives. As part of our ongoing support of our communities and each other, Bank of America committed $100 million in philanthropic support to help address the pressing needs related to the impacts of the coronavirus and the actions taken to keep people healthy, including the temporary closure of vital local resources such as schools and community centers. And through our philanthropic relief, we are helping global, national, and local organizations increase medical response capacity, address food insecurity, increase access to learning, and provide support of the world's most vulnerable populations. Here in LA, we've provided nearly $3 million to 50 nonprofits across the county who are working on the front lines to meet demands created by the surge of food banks and healthcare agencies, such as Ultimed, the California hospital located near Skid Row, the LA Regional Food Bank, MEND, Westside Food Bank, and many others. We've also committed $250 million in capital and $10 million in philanthropic grants to community development financial institutions to help support small businesses across the country. And like many of you on the line who are working remotely, we are at the bank also, many of us are working remotely. But our financial centers are essential businesses and have been deemed essential and need to stay open to meet the financial needs of our customers. Our financial center associates are receiving additional compensation, and we have established safety measures to serve clients every day. Our CEO also very early on said that there would be no layoffs this year, and since the crisis began, we have hired more than 2,000 teammates and committed to not laying off associates as a result of the COVID-19 impacts. I say all this because I know each of us is navigating an individual experience as COVID-19 continues to impact us in different ways. But this is the moment where our collective efforts as individuals, organizations, and corporations will be even more critical to build our resiliency and overcome the short-term and long-term impacts of this pandemic. So again, with much gratitude to the Luskin Center for bringing us together, we are eager to learn more about the current research and using the information to help inform our own strategies and efforts. And Bank of America is proud to be working side by side with you, and we look forward to uplifting our community. So thank you.
Thank you, Danielle, and hopefully we will see you next year in person. Thank you. Now to introduce the panelists. Gary Segura is a professor and the dean of UCLA Luskin School of Public Affairs, a position he's held since 2017. His work focuses on political representation and social issues, the domestic politics of wartime public opinion, and the politics of America's growing Latino minority. He served as an expert witness in 3 marriage equality cases heard by the U.S. Supreme Court, and he has filed legal briefs on subjects as diverse as voting rights, marriage equality, and affirmative action. And Dean Ron Brookmeyer serves as Dean of the UCLA Fielding School of Public Health. In his research, Dean Brookmeyer has a clear focus on global health problems, so he's an expert on the topics that we're discussing today. He's earned worldwide recognition for his work on predicting the magnitude of the impending HIV/AIDS epidemic beginning in the 1980s, and he has called attention to the looming epidemic of the Alzheimer's disease crisis. Thank you both for your contributions to academics and to social issues. And now Dean Segura will lead the discussion with Dean Brookmeyer. I'll come back at the end to bring you the Q&A, the questions and answers. And please, those of you watching, don't forget to type your questions into your Zoom window, and we'll be looking for them. And now I'll turn it over to the deans.
Thank you, Adrienne, and good morning to everyone. First, on behalf of the Luskin School and all of UCLA, we hope everyone is well and safe, and we know that this is a difficult time for the Los Angeles community, for the United States, and indeed for the entire planet. We want to begin by thanking Bank of America for their wonderful sponsorship of the event. I want to thank Adrienne Alpert and ABC7 for their support and participation. As we often do, we acknowledge the historic contribution of the Gabrielino Tongva people on whose land we have constructed UCLA as the historic and traditional keepers of this land. I'm pleased to be joined today by Ron Brookmeyer, who has recently been appointed Dean of the UCLA Fielding School of Public Health, but he's been at UCLA for several years, and it's a partnership that I've been pleased to participate in. And so Ron's going to share a little bit with us about the COVID epidemic from a public health standpoint, and I'm going to talk a little bit from the public policy, public affairs standpoint, and I'm sure we'll have some questions for one another. So Ron, why don't you take it away?
Great. Thank you, Gary, very, very much. Good morning, everyone. It is really a terrific pleasure to be here, and I hope everyone is well and safe. Let me begin by saying how great it is to collaborate with the Luskin School on this event. Adrienne, thank you for hosting. I want to thank the sponsor. Gary, it is really a great pleasure to partner with you, to be your colleague, and to be a fellow dean with you. You know, one lesson from this pandemic is that it takes partnerships and collaborations. Public health, public policy, economics, business, in fact, all parts of our university are critical to be able to look at this problem through multiple lenses. Everyone is impacted. And in the face of great uncertainty, we need to be able to pivot as new data and new information comes in. We need to be able to make decisions like, you know, when can we open schools for them to be on site? What about universities? When will it be safe for business to reopen? When does this lockdown end? How do we make these decisions in the face of great uncertainty? Well, it starts with facts, what we know. It starts with numbers. So worldwide, right now, we have over 2,500,000 confirmed cases worldwide. Worldwide, we have over 177,000 deaths. In the United States alone, we have over 825,000 confirmed cases, and over 45,000 deaths. And these numbers are surely underestimating where we are. New York City just adjusted upwards the city's death count by 3,700 to account for underreporting, likely COVID deaths that had not been tested. But there is good news here. In California, the hospitalization rates are stabilizing. Numbers of new hospitalizations stabilizing. And I think that hospitalizations is a good indicator of where we are and what's going to happen, and that we are moving in the right direction. Now, public policy, in fact, and public policy decisions depend critically on what we think is going to happen. How is this pandemic going to unfold? Is it a month, a couple of months, or is it years? When is it going to be safe to open up? So we turn to models to help guide us in this. So what do the models say about the COVID pandemic? And I got to tell you, there are lots of COVID-19 models, and some of them are at great odds with each other. Models basically come in two flavors. There are what are called transmission models, which simulate how the virus spreads in communities. And these models correctly predicted that an infection that's introduced into a community with no immunity, a novel virus, that we will have an explosion or exponential growth if the conditions are right. And those conditions are determined by a quantity that's called the reproductive number, R. Now, the reproductive number is, on average, the number of people that an infected person transmits the virus to. For COVID-19, that was about 2 to 3, which means every infected person transmits the virus on average to about 2 to 3 other people. And that's the condition for an epidemic to take off. In fact, when that reproductive number is greater than 1, epidemics go into a phase of exponential growth. Controlling an epidemic hinges on bringing that number under 1. And things like physical distancing help do that. Another way to control an epidemic, to bring that reproductive number under 1, is when enough people are exposed and successfully recover from the infection, so they develop immunity. And if enough people do that, that's called herd immunity or community immunity. And then the virus can't find enough places to other people to infect. And to get that herd immunity to kick in, we need about 50 to 60% of our population to have developed immunity. Unfortunately, I don't believe we're anywhere near that at the present time. Now, another modeling approach that's used, another flavor of models, is curve fitting models. And these basically extrapolate curves into trends and curves into the future. The Institute for Health Metrics and Evaluation from the University of Washington has one of those models, and that's the model that's cited frequently by the White House. And basically what it does is it extrapolates a bell curve. So if we have a bell curve, and then it just extrapolates it into the future. And bell curves eventually come down. But it doesn't allow for a plateauing of curves, or those extrapolation models don't necessarily allow for multiple waves of an epidemic. And in fact, we know, for example, in the 1918 Great Influenza pandemic, there were multiple waves to that pandemic that killed over 500,000 people in the United States. So I tend to look toward the transmission models rather than the curve fitting models to get clues to the long-term behavior of what we can expect in a pandemic. Now, certainly there are still lots of uncertainties with these transmission models. Some assume a seasonal effect to the infection. Some assume that once you recover and have immunity, the immunity is permanent, but others assume the immunity wanes. So there is uncertainty here, but they are useful for long-term forecasts, and they help evaluate the impact of different public policy decisions, like when can we relax physical distancing? How many contact tracers will we need to help contain the epidemic? So the bottom line, what are these models saying? Well, these models are saying without a vaccine, we may need intermittent periods of physical distancing to avoid overloading the healthcare facilities. And then the COVID-19 epidemic could occur and reoccur in multiple waves. Now, where are we with the current lockdown? The current lockdown has brought ourselves some time. The question is, are we making the best use of this time? If we suppress this first wave, do we have the public health infrastructure in place to contain future waves? Look, the virus doesn't know it was contained the first time. In all likelihood, there will still be pockets of the virus in different places, and small outbreaks will emerge. What we need to be able to do is to contain those small outbreaks as soon as they happen. We have to be able to stop it in its tracks. Otherwise, we're going to be just back where we were before. We're going to repeat the cycle of exponential growth. So what does it take? What does it look like to do that, to contain outbreaks when they happen? Well, we got to get it in front of this. And the first step is widespread massive testing. All symptomatics must be tested. There needs to be universal testing for some groups, students, healthcare workers. Second, there needs to be contact tracing for all contacts of cases. And all those contacts must be tested. And the positive contacts that are detected, whether they're symptomatic or asymptomatic, must be isolated. Third, there needs to be isolation of cases, of confirmed cases. So what does that mean? Well, you could be isolated in your household, but that may not be the best fit or appropriate for everyone. There may need to be alternatives. It's not a one-size-fits-all. So it's going to take national coordination of massive testing that must address reagents, swabs, adequate personal protective equipment for healthcare to deliver care and to administer the tests. And we're going to need a core of contact tracers, hundreds of thousands, 100,000 perhaps of contact tracers, and we're woefully underprepared for that.
Ron, can I ask you a question?
Sure.
So we hear a lot about testing, but there's actually two kinds of testing, right? So testing for active infection and antibodies. Can you share with us what the difference of those is and whether we need one or the other, or what's your thoughts on that?
Thanks. So there's PCR testing, which detects the virus. Now that's the testing that we're hearing about the most, and that's detecting if you're currently have the virus and have the potential to transmit to others. Now there's something new that's coming out, which is antibody testing. Antibody testing tells you whether you have been exposed to the virus previously, and have developed an immune response. So antibody testing could be extremely helpful in telling us who might be protected from getting reinfected. Now, unfortunately, though, as far as antibody testing and the data that I have seen most recently, there's question about the accuracy of some of the newest antibody tests that have been coming out. They don't have a good, what's called in biostatistics, which is my field, a good positive predictive value. What that means is if you test positive for the antibody, does that mean how likely is it that you truly are immune? And it could give a false signal. You could get a positive test to that antibody, maybe even giving you a false sense of security that you are immune. But I think at this point, the error on some of those antibody tests are still too big, and I think more work needs to be done with them.
Great, thanks. I wonder if you have anything to be optimistic about.
Well, you know, there are lots of things I think it's called attention to our public health infrastructure, and that there are really important the public health infrastructure has been really underfunded. And I think the calling attention to this will help us in preparing for future public health emergencies. You know, I want to say that in getting prepared, we have the opportunity to look at and use some of the new technologies that are becoming available, the GPS apps that are now coming out, which alert you if you are coming close to a positive case. But I still think that there are privacy issues with some of those apps, but I think there's opportunities to use them. I think where we're ultimately going to go here is there'll be a gradual and strategic, nuanced relaxation of physical distancing. As we do this, we can't forget basic public health measures, masks, cleaning surfaces, washing hands, covering appropriately sneezes and coughs, and doing all that while protecting our most vulnerable populations. We know that persons with underlying medical conditions are at the highest risk. We know that the elderly are at high risk. We have at-risk populations in the nursing homes, incarcerated, homeless. Randall Kuhn just from UCLA estimated the potential large impact on our homeless populations. And in California and Los Angeles, we're seeing a disproportionate impact of the COVID-19 on communities of color. In California, you know, African Americans make up 12% of COVID deaths, but only 6% of the population. So all of this is going to change us. And it's not completely clear how, you know, this effects of COVID are reverberating through our society. You know, I'd like, Gary, maybe I can ask you a question. You know, as a consequence of this pandemic, can you begin to speculate or predict what the long-term social changes will be, and how might policy address them?
You know, that's something a lot of folks have been discussing, and I wanted to thank you for your presentation and for your op-ed in this morning's LA Times, which I recommend to everyone online. You know, it's really hard to predict. We do know that big, giant social disruptions always have downstream consequences. And some of those consequences are for public health, as you know, and some of them are social. Let me give you just a couple examples. Prior to World War I, cigarette smoking was unknown. It was very rare in the United States. The vast majority of tobacco consumption was through pipes and cigars, which don't work very well on a battlefield. It is only after World War I where cigarette consumption jumps through the ceiling in the US society and has all sorts of downstream consequences for public health, which we now know in great detail. Another example, World War II. Not many people understand this, but World War II was very instrumental in the formation of the gay and lesbian communities and subcultures in the United States across the country in ways that had been really concentrated to a relatively limited number of locations. And simply by, you gender segregated the entire society for 4 years. And so you created the opportunity for people to find others who shared their orientation and allow them to build a community. So all social disruptions create some sort of downstream consequences. Not really clear what ours are going to be, but I have some thoughts on that, and I think I want to share those kind of as the culmination of what's happening right now. I will say that I think COVID has done us one favor, and that is that it's an incredibly good diagnostic tool. And what I mean by that is that it's allowed us to see things more clearly than we did before the crisis. COVID has revealed the searing depths of social inequality and economic inequality in the United States. They were there, we knew they were there was evidence of them every day as you drove down the street, but in a crisis like this, it brings such a thing into focus. COVID has made it very clear to the American people what the importance is of an effective and competent government, and what the catastrophe that can result from an ineffective or incompetent government. And so we see lots of good stories of places where government officials have used the instruments of governance and good policy advice to make a difference and to flatten the curve and to reduce the number of infections. And we also know of instances where institutions have failed us in large measure because they were ill prepared. COVID has made it clear how globally interconnected we all are. Something that was identified first in a provincial area of the People's Republic of China is now everywhere. And it took weeks, not years, not months, weeks, to be all across the globe. And that's just because of the nature of modern humanity and the degree to which we're all really closely connected. And as I indicated, and as I think, is a potential positive bright spot, is that COVID has actually revealed some things that we can do better to improve our quality of life. And I'll say something about that in a moment. So let's talk about inequality for a second. Housing inequality is a huge concern in Los Angeles, and I'm glad to hear that Randall has explored the impact of COVID on the homeless population. But the experience of homelessness in the current environment is obviously grim. And it is a problem more likely to get worse than get better in the short run. Why? Because as unemployment skyrockets to depression levels, there are many people who don't have the resources saved in the bank to pay more than a month's rent, if that. And so in the absence of income, we have tens of thousands of people in Los Angeles, millions of people nationwide, who are falling behind on their rent or mortgage payments. There is going to come a point where all of that comes due. There are people advocating for rent forgiveness, delays in mortgage payments, et cetera, renegotiation of mortgage terms. And I hope that that stays in the current conversation. But the answer with respect to homelessness is that there will be more homeless people at the end of the crisis, not less. Unemployment. I just completed a survey of Latinos nationwide for the healthcare provider Somos, which is a New York City-based endeavor. 35% of Latino adults have someone in their household who's already lost a job. 65% of Latino households nationwide have seen a declination of income, whether through a lost job or reduced wages or hours. at the same time, those very people are among the most exposed. 36% of the respondents in our survey were still working outside of their homes, and many of them feared for their safety. So for many of the working class folks in the United States, Latino, African American, or working class white, really what their choices are unemployment or risky employment, which is not much of a choice at all.
Yeah.
I also want to say a little something. Yeah, go ahead.
Gary, I was just going to just emphasize those points and just the epidemiology of all of this and the inequities in among our least fortunate populations that are living in very high density areas that where the virus can be transmitted more easily, not relying on public transportation where there are crowds, having employment where they may not be able to have the luxury of working remotely. All of that places populations, particularly underserved populations, at higher risk because they're in close contact of transmission. But then even after infection, in terms of risk of how the infection plays out in the human body and the risk of mortality, we know its mortality is related to underlying health conditions, and lack of insurance, health insurance, amplifies that, placing persons with a higher rate of underlying conditions. The racial disparity for comorbidities is clear in the United States. The diabetes rate, for example, is 80% higher in African Americans than non-Hispanic whites. Same with higher rates of heart disease, and all these comorbidities and impact mortality and how the COVID epidemic plays out.
And you know, the inequality becomes really clear in places that we often don't think of it. So I want to thank you for using the word luxury in association with working at home. It's also a luxury to do schooling at home. So as recently as 2 weeks ago, the Los Angeles Unified School District had only seen about 1/3 of its students check in online. And why would we think that's the case? Because when you think about re-platforming K-12 education onto the internet, that actually requires an infrastructure that not every family has. So if you have a parent working at home and you have multiple children in the household attempting to attend school, do you have that many computers? 37% of Latinos don't have access to broadband or the internet apart from their telephones. How does that work? How do those children go to school? So we need to remember that the idea of sort of the educational alternative, this re-platformed education, is itself a luxury good that not every family in America has the chance of being able to use. And when we think about things like, I'm glad you mentioned mass transit, like LA Metro is going to have some significant financial challenges as a consequence of this. There are water districts, small water districts in LA County that are likely to have substantial challenges as people can't pay their bills because they're unemployed. And we could actually see institutional failure in a couple of circumstances. So I think the challenges and particularly the inequities are going to be profound. You know, you asked a question about, do you want to jump in there?
I just wanted to ask you about, I know your school, trains social workers. And I was just wondering, the impact on social work and how that is playing out with the pandemic.
I'm glad you asked that. I had forgotten to mention that. So Professor Laura Abrams, who's chair of Luskin Social Welfare, she's had some dialogues with some Luskin social work alums out in the field. And frankly, the stories are just terrifying. And you can find those on our website, by the way. So for example, it turns out that children being locked at home is a huge threat to children who are at risk. When you think about children who are being physically or sexually abused, we rely on a mandatory reporter system, which is usually teachers, coaches, ministers who have contact with the children and can hear about what's happening in the household. Those children don't have any adult contact right now outside of their home. So we don't know what's happening, but we have a good reason to suspect it's not good. Another example is the families that are under DCFS supervision. Those social workers are actually visiting, but they go into a household, they're going into someone else's household now in this time of crisis. They want a mask, but at least one social worker told Laura that the children are afraid of someone in a mask. And so they feel like they have to take their mask off so as not to scare the child who is already under trauma. So I think we really don't think about all the different types of frontline personnel who are taking risk right now, but social workers are definitely among them. Mm-hmm. I would want to say one thing about sort of the long-term effects, and then I'd like to hear your thoughts on it as well. So COVID is changing our lives in a million ways, and this is going to be a little bit swimming against stream, but not all of the changes are bad. For example, has anyone noticed the air in Los Angeles? It's crystal clear. You can see from the top of the Sepulveda Pass all the way into the Santa Monica and Westwood. You can see from Universal City downtown. Do we want to go back to that? Do we want to go back to sitting on the 405 for an hour? I'm not sure. And when we go back to that, are we maybe a little more comfortable with telecommuting than we used to be? So this is an example of a social change that might have arisen from COVID. Telecommuting was resisted mostly by bosses who felt like there was no way that they could monitor the actions of their employees and who were used to a time measurement of productivity rather than an output measurement. So did you show up at 8? Did you clock out at 5? Rather than did you do the 14 things we needed you to do today? Every supervisor in America has suddenly had to rethink how they monitor their employees. And as a consequence of that, the possibility that more people could work at home and fewer people could sit on the 405 every day and then use those 2 hours that they used to use in a car for something more productive, including playing with their children or supervising homework or maybe even cooking instead of ordering Postmates or Grubhub. Like, these are things that we've become used to and we've internalized into our COVID quarantine lives. And I'm not so sure we're going to be all that happy to give them up. There are some things that are going to change potentially for the worse. There are entire industries that could go out of business because of this.
Yeah, but you're absolutely right. There could be things that will change us permanently, things that will be for the good. There's always good that comes out of things. I think your point about air pollution is right on. Our air is better. And I think we've also found out that there are things we thought we couldn't live without, but we can really live without them. We don't necessarily need to go to the mall multiple times a week. There are things that we also thought were impossible, that we thought we could never do, that we could do. I'm just thinking from an educational point of view. Universities have now gone to remote learning. It seemed to many that, we couldn't do that. It won't be as effective, but we're doing it. And so I think that will change us as well, and how we deliver education.
I agree entirely. And it does raise the question of whether or not some new efficiencies could be built into our economy. Whether it's telecommuting or multiple ways of delivering educational products. And that's not to say that there still isn't a huge value in what you and I do for a living, which is face-to-face education. And it's going to be difficult to operate a Bunsen burner in a lab when you're online as opposed to in person. So we know that there are challenges, but there are also some industries I think that are going to be in trouble. You mentioned the mall. I'm not sure closed air shopping has much of a vibrant future. Maybe, but right now there is no retail like everything's ordered online. And you got to wonder if that's going to grow. The other thing is, I wonder about movie theaters. Like, will movie theaters as an industry continue? They suffered a huge setback during the movement to video, and then they kind of recovered. But now new releases are being released through various streaming platforms, and you pay more for it. So there's still a financial model where you pay for a new movie, but you don't go to the movie theater and you don't buy popcorn. You use your microwave. So, there's the possibility of social disruption for good and for ill, or with unpredictable consequences. I think it's really large. Now, let me ask you a question, a more health-oriented question. Do you think medical delivery changes much here? Like, lots of people are doing telemedicine that never did that before. Is that permanent, or are we going to revert, or what's your sense of that?
Well, if you go into some of the hospitals, they're empty right now. Because a lot of the elective surgeries have been postponed. People are using telemedicine, and I think it's an interesting change to see to what extent we can rely on telemedicine. I do think many of the medical centers, academic medical centers, are being pressed financially right now because many of these procedures are not being done. There's only so long you can delay these procedures, and ultimately it will affect the health of populations. We're seeing that overall mortality, even not COVID related, is actually going up in the last couple of months, and that's reflecting not just the COVID deaths, but also people who may not be getting the appropriate medical care that they need for other conditions that they have, whether it's heart disease or cancer. So it may change us in terms of more telemedicine, but right now our health care system is really under pressure.
I think, Adrienne, that we're ready to hear from the audience and answer their many questions.
Let me start my video here. I was so wrapped up in your conversation. I was actually taking a few notes, and I know we have questions that have come in, but one thing I wonder if both of you could address, it kind of goes to everything you've both been talking about. You're well aware of all the public pressure that's through protests, trying to open things back up again, and the lockdown. Dean Brookmeyer, you talked about these pockets of COVID flaring back up again. What do you think will happen if the politicians yield to the pressure and end the social distancing sooner than later?
I'm very worried. I'm very worried if the social, by the way, I call it physical distancing, just because I think we need to be as socially connected now more than ever. And what it's about is not being socially distant. It's about being physically distant. And I'm very worried that if we do that and we don't have the necessary public health infrastructure in place, this thing will just explode again. There'll be an outbreak, and if we're not containing it, if we don't have that public health infrastructure, which means testing, contact tracing, and effective isolation of people who are transmitting, whether they're symptomatic or asymptomatic, and we know there are significant numbers of asymptomatics that can transmit, I think we'll be right back where we are. And so we need to do it thoughtfully. We need to do it in a nuanced way. It won't be a one-size-fits-all, but as we start to relax the physical distancing, we absolutely must have testing in place, we must have contact tracers in place, and we must have effective ways to isolate those people who are transmitting the virus.
But Dean Segura, I think that you could weigh in here too, though, the economic and social implications on parts of the population that need to get out and work and can't practice these physical distancing measures.
Well, it's certainly a challenge. In the survey we just did among Latinos, 81% of the respondents said they favored staying locked down. And I think that the best message when we characterize these protests is that these protests are fringe and these protests are small. And in every reliable public survey that I've seen, national survey of the American people, numbers north of 80% favor staying locked down until we're safe. And remember, the 81% we found of Latinos, these are folks, many of whom are at risk and who are in economic straits because of the circumstances. And so the answer is, how do we balance those things out? And I think there is, we balance them out all the time. And, Ron will probably have more detail on this than I would, but every day you leave your house, there's a public health risk, right? You could contract flu, you could be hit by a car, you could, I don't know, a piece of the space shuttle could fall on you or something, I don't know. The world is filled with hazards, and the death rate hovers around 100%, everyone dies. And so we do, in fact, make these calculations all the time. If we perfectly socially isolated ourselves forever, we would dramatically reduce premature death, but death would come nonetheless. So we are, in fact, engaged in balancing. But there are some simple, rational calculations to be made, which is what you want to do important enough that when you do it, one person in that organization would die in the course of a year? How about you ask a different question? Is it still worth doing if one person died each month? Is it still worth doing if one person died each week? And so I think we need to calibrate the relative importance of the activities we want to do against its potential costs.
One concern that I have is people hanging their hat on that a vaccine will be here very, very soon and will save us. A vaccine will eventually be here, but I'm not so sure about how soon it will be. Some estimates are saying 12 to 18 months. I actually think that's probably a fairly optimistic timeline. Clinical trials take time. First, you have to have a study for safety, efficacy in terms of whether antibodies are produced, and then it goes into these large-scale, what are called phase 3 clinical trials, which involve thousands and thousands of people, and all of that to make sure this is safe and there are no adverse reactions. Even if we got to that point and we had a safe and efficacious vaccine, that's only half the story, because then you've got to produce the vaccine. You need millions of doses. So if you have a vaccine that takes 2 doses, and you've got 300 million people, you're going to need to produce 600 million people, and we can't underestimate what it's going to take to do all that. And even if you have the doses ready, then you got to deliver it and get it to the people that need it. And that is not an easy job. I mean, we know that, and if you just look at smallpox, we had the vaccine for smallpox developed by Edward Jenner in 1796, but it took us till 150 years, till 1980, till we actually eradicated smallpox. Same thing with a number of other vaccines where we developed them, but it took a while to get it to distribute it to the people who needed them. Rabies is still widespread, even though we have a vaccine. So it's also, why are all these delays? Because we need also to not just develop the vaccine, make sure it's safe, get enough doses, but then we need to get it to the people and distribute it. So the bottom line of this is, don't forget basic public health like physical distancing and contact tracing. Those are the things we can do now, and we should do them now.
All right, Deans, let's go to, we have lots of people who have written questions. So if we can try to get through these in about the next 25 minutes, it would be great. Let's just go down the list. I'll read you the first from Jennifer Wong, who asks, where are the sites that we can easily look for COVID-19 data? Is Luskin starting a website to collect these numbers?
We are not. Public health is something that we let the fielding school take the lead on, Ron.
Yeah, we do have a website. please go to it. If you go to Fielding School of Public Health website, you will see right there the novel coronavirus information page. I should also say I'm very pleased that we have it up in, there's a multilingual site that's called Breaking the Chain of COVID-19, and we have it in multiple languages: Spanish, Chinese, Vietnamese, and more languages are coming online. We want to be able to get this information out to the people who need it, and especially in our very diverse community in Los Angeles. So please check out our UCLA Fielding School site. There are other sites, and I'll mention some other universities, but they're very good. The Johns Hopkins University has a really excellent site that has collected some really excellent data and excellent displays of the information. And also the World Health Organization site also has some very good sources of data.
All right, let's go on to our next question. Let me see, it just disappeared. This one from Jack Gibbons. What are the current plans for UCLA and other UC campuses to reopen in autumn? That gets back to your predictive model, doesn't it?
Wow, that's a real tough question. We're struggling with it. All universities are struggling with it. What are we going to do in the fall? Most universities are remote over the summer, and we're going to need to pivot, but we need to be prepared and look at what the options are. Most universities, including our own at UCLA, have a task force, and I'm pleased to be on that. I'm actually chairing that task force, looking at what the different options are, and other universities in the and within the UC system are looking at it. What are the options? One, we could be remote in the fall. That's certainly one option. A second option is we come back to campus face-to-face with appropriate testing and physical distancing in place, and contact tracing as needed. A third is some kind of hybrid version of the two, some remote, some on-site, where we can maintain a low density of people. And all of these decisions have to be made in the context of what's happening in the city, in the state, and in LA County, and keeping all of that in focus as we decide what to do.
All right, I didn't know if Dean Segura wanted to jump in on that. I see you there, so
I'm sorry,
go ahead.
I didn't hear the question because my internet failed briefly. The struggle of infrastructure.
There it is. No, the question was the idea of the UC system, including UCLA, opening for classes on campus in fall.
Wow, I don't know what Ron said. We don't have guidance on that yet. We know that summer session A is going to be taught remotely. Summer session C, I think we're still waiting on a final decision. But my understanding is, and Ron, you may have already said this, is that the Office of the President is very committed to making a single decision for all 10 campuses. And so we're waiting for guidance on that. Is that what you said, Ron? I'm sorry.
Pretty much. We're looking at it at UCLA, and I certainly agree. The more that we are be unified, I think will be helpful for students, and also help send a single message of whether it's safe, but we also have to look at the infrastructure that each of the campuses has to be able to have appropriate physical distancing and appropriate testing and contact tracing in place. So if there is a decision to come back to campus, we have to make sure that that's in place.
Howard Walensky is oh, sorry, I was going to move on to the next question.
Just that it's not necessarily an on-off switch. There's an infinite number of ways that we could reopen the campuses.
All right, and we'll wait to see how that plays out. Howard Walensky is asking you, could you address the recent spike in cases in LA County? I think some of that, though, we've learned, isn't it, that there was some delay in reporting in a number of the cases.
Well, what I would say on spike of cases is we have to interpret it cautiously because because cases can spike because there's also an increase in testing and availability of testing. So when we see a spike in cases, there are two reasons that could be. First, there could just be, we're looking for it more, that there are more testing going on and more availability of tests. The other reason is that there really is an increase in infections, and it's pretty hard to disentangle those two effects. That's why when I look to track the epidemic, I look at two other measures. One is hospitalizations. People come to the hospital regardless of voluntary testing if they're very ill, and of course deaths. Deaths is more downstream, whereas hospitalizations is, in terms of time lag, is closer to when the infections actually occurred. So I look at in hospitalizations in California, and there are some good sites for data to looking at some of the data in California. They are starting to tabulate hospitalizations by county, and you can take a look at that. And what I'm seeing is a stabilization in the number of persons in the hospital for COVID-related conditions.
All right, I was giving Dean Segura a moment on that too. Moving to, let's see, this one is from Troy Gabrielson, who says, what is the feasibility of contact tracing nationwide, given the number of people infected?
So, Ron may have a different take on this. I think that the contact tracing mechanism is something that we would put into place in an aggressive sense only when we were on the tail end of the crisis and trying to reopen institutions, so that if a cell of infection would emerge, then public health officials would jump in there, do the contact tracing around that small cell, try to tamp down that flare-up. I don't think that anyone is proposing contact tracing on the hundreds of thousands of people who have already been infected. This is something I think we would focus on at the tail end. Ron, is that correct?
No, I'm not sure about that. I think if people are going out and getting tested and they're positive, they're found to be positive, I do think we should be intervening. I think we should be doing as much as we can with that information. And if somebody is found to be positive and carrying the virus, I do think we should be doing contact tracing and identifying their contacts, and those contacts should be tested. It's hard to say. I wouldn't, wait till, this is a public health measure that we could put in place, but it absolutely does take infrastructure. And I agree, we may not have the trained contact tracers we need right now. We don't necessarily have some of the apps that could be helpful in that to identify right now if you've come close to somebody who's positive. But I don't see any reason to wait, provided we can do it and provided we have the resources to get it done.
So I don't disagree with that. I was just thinking, during the period of lockdown, most folks' contacts are the very immediate people that they're locked down with, and it would make sense to follow up on those. But I was more concerned about the period of time where asymptomatic carriers might actually be circulating through society. There, I think contact tracing is absolutely required, or we can't reopen the economy. Would that be correct? Or?
Yeah, no, absolutely. I mean, I agree that let's say we get through the first wave. Let's say that we get down to, the number of cases has decreased to very low levels. At that point, we need surveillance. We still need testing, and we then need contact tracing. Absolutely, because that was the problem that got us into this predicament. We didn't get ahead of it. We had warning, but we didn't get ahead of it. And here, once you start an outbreak, you have an opportunity to break that chain and to break that community transmission if you get ahead, identify cases, and identify contacts and intervene quickly.
We have so many questions. Let me just try to jump in here one, because Sarah Pillsbury is asking a question that goes to this issue and follows up with it. She says, yes, we can see the public health has been woefully underfunded, but do you think the general public is beginning to understand the concept of public health, that good health is about taking care of everyone in our community and not just ourselves?
You know, thank you for that question. You know, we've been woefully underfunded and underprepared in public health, and especially in public health education. You know, most of us have never experienced a public health crisis of the magnitude of COVID-19 pandemic. And it's really hard to understand and grasp unless, and the enormity of this situation, unless you have a reference point for that. And I think there's a lot more that we can do in terms of public health education to make people more prepared and understand what's going on. History teaches us, even if we haven't had an opportunity to live through it ourselves, the 1918 influenza pandemic and other pivotal events in the history of public health help sensitize us to what can happen. You know, we prioritize in our education among American students, we prioritize compound interest and how that creates, great fortunes. But we don't put the same priority in terms of that concept of exponential growth that grows great fortunes on teaching how a few infected people can grow exponentially into a global pandemic. And it takes a while to understand that. And without that training and understanding and education, that creates delays in our public health response. And every day that we delay in a public health response, as the public tries to get a grasp of this, understandably, it's difficult, but that could cause thousands of additional deaths. So I think public health education is critical, and it's not just for those who aspire to have careers in public health, but it's also for those, for everyone, for the general public, and certainly for our political leaders.
Let me say something about the mutual concern portion of your question. So there's kind of two elements to it. What does the public understand about public health? And as Ron's pointed out, people just didn't get what exponential growth looked like and what that meant. But I think the second part is, are people concerned about one another? Does the society have a sense of a collective identity? There's lots of things to be down about. Let me say something more positive, and then with a giant asterisk. More positively, this society is among the most charitable in the world. It turns out that Americans of all stripes, and particularly working class Americans, are very, very likely to give from themselves as a way to help the community. Where I think we fall down is that we don't necessarily understand that there are times when government is the principal mechanism to provide that help. And so we have these mythological, ideologically driven statements about how mutual concern can be reflected through civil society organization, not-for-profits, and they're all doing a heroic job. And also that the market will solve problems. Well, you know what? There are some problems that require government institutions to implement the policies necessary to protect the collective well-being. The market was not going to solve COVID, and there aren't enough charitable organizations in the world to take care of the number of people who are ill. That's just simply not how that works. And so I think where Americans fall down is from the movement of trusting or wanting to care for one another and wanting collective well-being to actually understanding that they have to build an infrastructure in order to make that happen. That infrastructure includes public health. It includes quality healthcare, quality services for people who are struggling, fewer people living on the streets, care for people who are having trouble making ends meet. Like all those inequities I talked about earlier needed to have been addressed far long before COVID ever made its unfortunate appearance.
All right, we have questions are pouring in now to both of you. This one actually is coming in from Les Dunseth, who says, what are your thoughts about the wisdom of allowing the response to COVID to be so different from state to state or city to city?
I'll go first on that one. That's a catastrophe. And it's a catastrophe because viruses don't know state boundaries. Human beings don't really live state boundaries. And by the way, you've seen a number of efforts or conversations about states imposing restrictions on other states' populations or whatever. That's just fundamentally unconstitutional. Citizenship resides in the United States for US citizens, not in a particular state. So it's been disastrous that we've had this patchwork, because an infected person who leaves a place like Georgia, which is doing away with its distancing measures, and comes to California, still represents a severe threat to our public well-being.
I absolutely agree with that. The virus, look at it from the virus's point of view. The virus doesn't know any boundaries. They don't know state borders. We think back to spring break and all the college students in Florida on the beaches, and then they went off and flew back home and back to their colleges, and they were just spreading the virus all over the place. So, to be unified, to have have consistent policy is really important if we're going to control the virus.
It's interesting to note here that California, Oregon, and Washington formed an agreement that whatever plans of reopening would be done in concert with each other. I think it goes to the very issue that you were talking about there. And this next question from Barbara Broad also goes to this, who asks, are there examples of attempts to actively build herd immunity? Are there any places that have attempted to identify populations less likely to experience bad outcomes and expose them to the virus to isolate them as they experience the disease?
So that was an attempt that was originally started by the UK, and they were following that model, and then they realized the great cost it was having on their society, and the great cost it was having on their healthcare system. The whole idea is not to have a big ramp up, an explosion, right, of cases, because then you're going to exceed the capacity of the healthcare system. So we do want to start to have some herd immunity, and either ultimately through a vaccine, but it has to be done in a very nuanced and strategic way, and a policy that just said, okay, everyone, get infected and we'll have herd immunity is that it has to be a much more subtle and nuanced approach than that.
All right, we can move on to our, if we can move to the next question. And this one follows up, Dean Segura, on what you talked about. This person is asking, well, she just went. This is Jonathan Reed, who is thanking you for the presentation, but asking, what are some ways the philanthropic sector can support the recovery? You had earlier mentioned that philanthropy can't pay for all of it, but where are philanthropic dollars best applied in this case?
That's a great question. So philanthropy is, I think, going to be most involved in the alleviation of suffering and in attempting to sort of rebuild and resurrect communities which have been really badly damaged. There is one particular community in Los Angeles that is really deeply challenged, and that's the immigrant community. Not everyone is aware, but the CARES Act specifically excluded payments to anyone who had an ITIN number, an individual tax identification number, as opposed to a social security number. Now, that was articulated as a desire to not distribute funds to unauthorized immigrants. I disagree with that policy, but it is what it is. The problem, of course, was that the way the policy was applied, any household tax return that had an ITIN number on it was ineligible regardless of who else lived in the household. So if you could imagine a married couple, one person is an unauthorized migrant, the other is a US citizen spouse with 2 or 3 US citizen children, they received nothing in support from the federal government. These are types of communities where the feds are just not going to help. And so not-for-profit organizations are going to have to step in and fill in the gap. I think there are all sorts of vulnerable populations where the nonprofits are going to be super helpful. Senior citizens who are isolated, who live alone, no one's talking to them. How do we talk to them? How do we care for them? How do we make sure that they're receiving food and replenishment? That's a place where I think civil society organizations can be helpful. Children who have undergone trauma, that's a place where the nonprofits are going to be super helpful. Of course, the homeless, which we mentioned earlier in the call, that's a place where civil society organizations are going to be critical.
All right, let me dial this back in here. This next question, I don't know, fielder's choice on this one. Mark Lunder is asking, how do you see the balance between clean air and a productive economy working out the trade-offs? Does the higher monetary cost of clean air further exacerbate social inequity, i.e. manufacturing products in the United States, and the costs more, and electric cars cost more as well?
So I guess that's probably more in my portfolio. A couple of thoughts. First of all, manufacturing is responsible for some portion of air pollution, but not in Los Angeles. In Los Angeles, vehicular transport is the single biggest cause. And actually, mass transit, including airlines, airplanes put a lot of dirt in the air. Manufacturing, of course, can have pollution issues, but I don't think that's the trade-off we're concerned about. With respect to electric cars or whatnot, there are tax abatement programs which are designed to make those more affordable to more people. And over the course of time, the entire automobile economy is about to change as a consequence of driverless vehicles. A lot of folks today are opting to not buy vehicles, particularly young people, because the carrying cost of a vehicle for a year is actually quite high, and these individuals might need individual vehicles only a certain number of days a year and prefer the shared economy, the gig economy to get the places they need, or the zip car kind of strategy. So I think the entire automotive, the relationship between people and cars is changing, and changing quickly.
All right, let's, this next question is coming to us from Shrivastava Priyanka, who says, until the vaccine is released, can the government invest in protective gear for everyone so that people can use it, go back to work? Is that too unrealistic?
Well, certainly, well, I think protective gear has a role to play. I'm not sure how effective it would be, and if there would be adequate resources to put everyone in the appropriate protective gear that you need. I think we want to have a measured response, and I would come back to decreasing density of people. We have to think very hard about events like sporting events and large concerts, and maintaining the necessary physical distancing. I would have, it would be hard to imagine some of the protective equipment at those kinds of events. And so I think we need measured responses, and certainly we need protective equipment, adequate personal protective equipment for all of our healthcare workers.
Adrienne, as we wrap up Q&A, I'd like to say 2 things. First, thank you for moderating for us. And second, I want to make sure I take the chance to thank the Luskin Summit Board Committee, chaired by Wendy Gruhl, and the entire membership of the Luskin Board who've been so supportive during our transition to a re-platformed Luskin School and in support of this virtual Luskin Summit.
All right, so we should be then saying thank you to both of you deans for weighing in. There were a whole lot more questions in the queue, so we want to thank everybody who's been tuned into this webinar for actively participating, and hope that there was quite a few answers that came through, so that's a big thanks to everyone. So as we sign off with some important words from Wendy Gruhl, who is a former LA City Council member and City Controller. She's a member of the Board of Advisors of the Luskin School, and she chaired the committee that put this webinar together. So here now is Wendy Gruhl, who I'm very sorry I am not seeing in person either.
Thank you, Adrienne, and I really appreciate all of those of you who have joined us today for our virtual Luskin Summit. We're glad to be able to connect with you despite the extraordinary circumstances we are all currently facing. I'm a proud member of the UCLA Luskin School of Public Affairs Board and chairing the Luskin Summit, and I'm impressed every single day with the impact of our faculty and students at UCLA Luskin. We hope that you have become more informed of the pressing needs of our LA County and came away with ideas and solutions and action steps to address these issues. Hopefully you will take the post-event survey, and I'd greatly appreciate your feedback on that, and particularly to let us know what other topics you would like us to address in future events. I invite you to continue your engagement with the Luskin School through attending future events, supporting our faculty and students, or sharing our great work with others in the community. Please be our advocates so we can help find further solutions for the issues we've talked about today. We have created an emergency fund to help support students who are experiencing financial hardships, as you see on the screen, that has adversely affected their success at UCLA, and a Luskin board member has graciously funded a match, and we appreciate all of your support. And we support, and we particularly want to thank those community partners who have generously sponsored this series. And the many series that you will hear from has been possible by those contributions. And of course, thanks to our dedicated Luskin board members who serve on the planning committee. As we began this process, of course, we thought we'd see everyone in person, but the team and the Luskin board moved quickly to be able to provide this to you with our Zoom events. So thank you for joining us today. Have a wonderful day. We hope you can join our next Luskin Summit, and together we will be able to work to make Los Angeles better. Thank you so much for joining us. Thank you to our panelists, and thank you to our extraordinary Dean, Gary Segura.